love diving into the latest wellness secrets on the podcast, then you're going to want to join my exclusive weekly newsletter. Get insider wellness tips you won't hear anywhere else. Be the first to know about my upcoming fasting workshops because let's be real, fasting is the secret weapon for surviving perimenopause. Access my weekly essentials, tools, and biohacks to help you thrive in midlife. I promise to make it worth your while, straight to the point, no fluff, just powerful tips to help you feel your best every single week. Don't miss out. Sign up now at thewelldrop.com. Let's take your wellness to the next level together. Welcome back to The Well Drop, where wellness meets real life for women to reclaim their power one drop at a time. Today, we're getting into something that every woman needs to understand, but most of us, or almost like none of us, are ever taught, and that's hormonal shifts in midlife. Joining me is someone who's changing the game in women's wellness, Dr. Sarah Daccarett, founder of Oestra and Inner Balance, the visionary of hormones specifically designed to support women during perimenopause and beyond. Dr. Sarah is a powerhouse. She's a doctor, a researcher, and a fierce advocate for rewriting the story around how we support hormones, not with outdated scripts or blanket fixes, but with science, soul, and real bioavailable support. In this episode, we'll unpack what's really happening during perimenopause, the sneaky symptoms women miss, when and how to start supporting your hormones, and how Oestra was born to fill the gap women didn't even realize was missing. This is a conversation that every midlife woman and honestly every practitioner needs to hear too, because hormone health isn't just about fixing symptoms. It's about tuning in, taking charge, and learning how to thrive in the second half of life. Let's drop in. Dr. Sarah, thank you for joining us on The Well Drop.
Thank you, Amber, for having me.
I think the best place to start is I'd love to learn about your personal story. What was your why behind entering the women's wellness space and specifically focusing on hormones?
Yeah, it's a long story, but I started because I needed it. I went through it. So I was in my 30s, mid 30s, 35, just like women all around me today are doing it. And I didn't recognize what was going on. And I'm a doctor, so I can imagine what other women are doing. I struggled after delivery of my son. I tried every product on the market. Once I realized it was hormonal, I realized one, that I didn't have the tools. I wasn't taught anything in medical school. And we literally ignore it for women. We pretty much think that hormones are not, either interesting or that they're not valuable or something, that there's kind of this perception that they should be ignored for women and that they're just for pregnancy. And that's it, for helping women get pregnant. And so when I tried all of the formulations on the market, you realize that none of them were designed for 35-year-olds. They're really intended for menopausal women, a 65 and above, even 60 and above, to help prevent them really from having hot flashes. That was it's because it's one of the most debilitating symptoms. And so they're only designed to stop those or really kind of maybe take the edge off of vaginal dryness. It's microdosing of hormones. And even today, 10 years later, now we're talking about menopause. We're finally talking about it, but nobody's talking about the formulations and how outdated they are. We're still prescribing patches and pills like it's 1990, when we've made a decade of progress in men's hormone health. We have labs, we have everything for them. And we still give topical creams and pills and patches to women. It's embarrassing how behind we are in the technology and innovation in this space for women.
And I think that's why we're so excited to have you on, to really break the silence on hormonal health. I think, sadly, like you said, it's completely just not thought of. I mean, we are complicated beings. I think the word is out now and people are starting to understand that we've not been in most scientific studies, most products that are on the market. We were never thought of. We weren't in the lab. And so especially, I didn't even know at the time growing up, perimenopause was even a stage. I think most of us only knew, okay, you get your period, try to have a baby, you focus sort of on ovulation. And then there's this menopause stage, which felt really far away. But who knew that there's this almost decade of this perimenopause space? And I think unless you're having hot flashes, most doctors have nothing to offer you. Is that true?
It's true. And even if you're having hot flashes, they don't offer it to you unless your period has stopped for an entire year.
Right.
We don't tell men, hey, you have to stop making sperm for an entire year before we give you testosterone replacement therapy. It's ridiculous. Like, why would we wait for women? We don't wait to treat diabetes. We don't wait to treat heart disease or anything like that. We treat it. Even perimenopause, but what about endometriosis and PCOS and all of these problems that younger women are running into? This is also hormonal at its core.
And I think that is like the biggest missing piece is for us to actually think about like when you're starting to feel something that is just a little bit different, whether it's brain fog, and you can tell us like the most common symptoms that you've seen in your practice for people to think, oh, it could be my hormones. Like once you maybe check your vitamins and minerals, like what's like the order in which like people should start like trying to figure out like what is the core of my issue?
Yeah, I think that this is a common question. And how do you know what the root cause is? Because women are told that their root cause is leaky gut, or the root cause is high cortisol, or a vitamin deficiency. So if you have leaky gut, this is a symptom. If you have high cortisol, this is a symptom. It's not the root cause. If your cortisol is elevated, it's because you don't have estrogen and progesterone to regulate it. Women need to be thinking about, if you have leaky gut, it's because you don't have estrogen and progesterone in order to make your gallbladder work appropriately and create enough mucin, or if you have a bunch of like gap junctions in your gut because you don't have your hormones around for that. I think that women need to understand that hormones are foundational. Like, they essentially regulate every process in the body. And if they understood that and how important they are, they would stop trying to like inject vitamins or think that it's a vitamin problem. It's really like, if you have a deficiency, your vitamin deficiency is not going to give you leaky gut and high cortisol or some of these really severe symptoms that women have. If you have a collection of problems, if you have anxiety and depression and irritability and you can't sleep and you're fatigued and your skin and hair doesn't look like it used to, you have this low libido and you blame it on your partner, you're gaining weight slowly, this is all related to the same thing. We attribute it to like different things. Oh, I just need to change my diet. Oh, I just need to go to bed early.
Yes,
But in
like women, we're
reality,
exhausted. Like we really are just so exhausted trying to figure it out. I mean, I would say I started feeling symptoms probably around 36, and I started with like the vitamins and minerals, my gut. I mean, everything that you're saying is sort of what I started. And then only in like the last few years, I realized, oh my God, maybe it was hormonal that whole time. But how do we even know if it's hormones? Like, is there a test to do? Because in traditionally, doctors only go off of symptoms. Like, is it just more symptom based and actual like a blood lab or a Dutch test? How should we think
the
about that?
I think the problem with the laboratory testing is, one, it's not well established with the reference intervals. So even as good as some of these companies coming up like Dutch testing or a lot of the point of care stuff, the reference intervals are not optimized. So for example, there's only 5 papers in the entire world to even address this question of what is your optimal progesterone range? Like, even if I get a lab on you, like, the labs don't even report 0 as abnormal for progesterone. 0 is normal for estrogen. They don't report like a low level. So there's nothing to like guide physicians. Dutch testing, I would also argue, they're basing it off of their population of women, but it's not based on what an optimal should be. Like, what a 20-year-old, like, I don't want to feel like a 44-year-old. I want to feel like a 24-year-old, right? So like, I think that when you look at HRT, you're trying to optimize to a younger state, to a younger age, not to like your current age. And so the laboratory testing one, it's true, it's because it's all over the place. I think that you could use it, but the reference ranges are really, really messed up. So estrogen, the top level of normal is 500 picograms per milliliter. A lot of women feel better when it's higher. Like, this is something that we've already solved for men. We used to keep them like really low too. And now we've realized that men do need, their testosterone needs to be 1,000 or 1,500 in order to feel better. So I would say that's one problem with the labs. The other one is nobody's ordering an FSH. So if you wanted to try to follow your over time, like instead of this like point in time that like an estrogen and a testosterone and a progesterone will give you. Oh, and I would say 80% of the time the doctors don't even order progesterone, and it's like the woman's main hormone too. So there's
a
yes,
lot
you
of
could,
that too.
yeah.
So if someone is going to their doctor, what should they request from their doctor that they want checked in their labs?
You could get an estradiol, a progesterone, and a testosterone, an FSH, and an LH. But an FSH can give you, and it's not perfect either. So I just want women, if you get normal labs, even a normal FSH, and you're 36 and you're still having problems, you have to know when to ignore the labs as well. So they can be guidelines and they can be helpful. And if you have an abnormal FSH, meaning the FSH is 8 or above, this can be a sign that the brain and the ovaries, the ovaries are struggling to make hormones.
Yeah, and we're not taught this. I mean, we don't even know this. Do the doctors traditionally know this? Is this not taught in
Doctors don't. It's not
medical
taught in medical
school?
school. The
Okay.
doctors don't even know it. And I would even say a lot of longevity and hormone replacement therapy doctors also do not use FSH. So this is a marker that's highly underused. We should be using it as a screening test for women. I think if you were to follow anything in your 20s and 30s, it could be an FSH. We just look at it as oh, how many ovaries do you have left? But that's not really
Right.
what it is. It's a sign of that the brain is struggling, is freaking out. Like when your ovaries aren't producing your main hormone, which is progesterone, FSH will rise.
Okay.
And so the brain is telling the ovaries to make more. This is something it's called follicle stimulating hormone. So the brain releases this, and it's a sign that your brain is make more hormone. And then the ovaries will try, and they can't make progesterone, but they can make a spike of estrogen, right? They'll make this spike of estrogen every now and then. And then women happen to get laboratory testing, but they don't get the FSH or the other markers. And then
And
they're
then they
told that their
don't know.
estrogens are too high.
Mhm.
No, they're told that they have estrogen dominance. You don't need estrogen. And then they're steered away from it for years, told that estrogen's dangerous, that they don't need it, that they only need progesterone. And then even if women do get help, they're treated inappropriately. They're only given one hormone. They're either given only testosterone or they're only given progesterone, right? So
Yes, I'm
even
seeing
though
this all the time, and this is where I sort of want your clarity on it, because most doctors, even me, I just had, 2 different appointments just in the spring where I had my regular doctor, and then I even consulted with, a women's specialist. I just wanted to hear what they had to say because I was already working with your product. And most people in general start with progesterone. They'll be given a progesterone either if it's a cream or they're gonna be given a pill. But estrogen is not even thought of here. And I think the biggest thing is that everyone we have to start thinking outside the box because it's going to take another 2 decades until the scientific community is going to catch up with the reality of what is today, right? Like the Women's Health Initiative study from '02 was just debunked. And so we kind of have to take matters into our own hands, which is what you created with Oestra in order for people to finally do that. So can you explain why maybe just taking progesterone by itself may not be the best option?
Yes. So, one of it's the formulation. If you just oral progesterone is what's typically given. And this creates a lot of liver metabolites. 80% of it turns into liver metabolites that can make you sleepy. They can cause a lot of side effects. They can be converted into testosterone. They can really disrupt this ratio. If you take 200 milligrams of oral progesterone, this is only 20 to 40 milligrams of progesterone. This is not enough it's the same thing. I don't give men oral testosterone. It would break down in the liver and they wouldn't get enough. Why
Mhm.
are we thinking that this microdose of progesterone is enough for younger women? So that's part of it. Another problem is that if you were to give her enough, let's say 800 milligrams of progesterone, which I've seen written, a lot of women have tried that,
Wow.
or even a vaginal progesterone, and you do that alone. Let's just say they're doing it in a really superior way. You are going to suppress this cycle of FSH that we described just now, and then you're going to end up. For women, it's a ratio. We need all 3 hormones, and we need them in the right ratio. And everybody's like, "What's the magical ratio, Dr. Sarah?" I'm like, the magical ratio is actually whatever your body. It's individual. Your ratio is going to be different than mine. It's going to be different than my friends, and it depends on your genetics and metabolism and the formulation that you're taking and how you're absorbing it. But the ratio has to be the progesterone has to be the highest. And it's usually at least 10 times higher, 10 to
Wow.
30 times higher. And then you have estrogen and testosterone that are about the same amount. So if you just give her just progesterone, but you don't really know that she's making enough estrogen all the time, then she'll end up with symptoms like greasy hair and vaginal dryness and acne and bloating and weight gain. And you've
I
created a
get
lot more
those
side effects.
complaints all the time, like this adult onset of acne. I mean, most people are taking the progesterone at night because it's supposed to help make you sleepy, but it almost starts doing more damage than good because you're not having that other balance.
Well, and we just say oh, you need to sleep, you need progesterone, but hormones are not like that. We need estrogen and progesterone to sleep. The hormones work together in the body. We don't we look at it as such an isolated thing, oh, we need testosterone for libido. No, we don't. We need all three hormones for libido. We need for metabolism. We need all three hormones for your brain to function and for your, to breathe and your blood pressure. So if we just give one hormone to a woman, we're half treating her. That's it. That's all we're doing. And we're kind of like a band-aid fix. Like, here, let me give you kind of like a sleeping pill so that you can try to sleep. But at the core, we're not doing it right. Like, we're not optimizing all three hormones by doing that.
If you love diving into the latest wellness secrets on the podcast, then you're going to want to join my exclusive weekly newsletter. Get insider wellness tips you won't hear anywhere else. Be the first to know about my upcoming fasting workshops because let's be real, fasting is the secret weapon for surviving perimenopause. Access my weekly essentials, tools, and biohacks to help you thrive in midlife. I promise to make it worth your while, straight to the point, no fluff, just powerful tips to help you feel your best every single week. Don't miss out. Sign up now at thewelldrop.com. Let's take your wellness to the next level together. And so, another thing that I hear often, a lot of women are prescribed birth control, which I wanted to clarify are more synthetic hormones. Are those, like, can we explain the difference between a bioidentical and a synthetic hormone? I guess is the
Yeah.
starting point.
I
And
think
then
like
go to birth control.
I feel really bad that I feel like this is one of the more devastating thing that's kind of happened to women and women's health is that we've created this chemical that makes them infertile, and we call it birth control, but we also call it hormones.
Yeah.
And then we try to call it a synthetic hormone. But even just using the word hormone, it's not a hormone.
It's confusing.
It's confusing. And then we study these like synthetic chemicals, and then we call them hormones, and then we extrapolate and say that all hormones are bad. And we don't do this to men. We haven't made like a fake testosterone and then made from estrogen, made them infertile, and then study that and then tell them that testosterone's bad for them. So it's like women don't even understand, like, it's kind of what occurred to them. But the birth control is not a hormone. It binds to that receptor, but it has a different impact on that receptor. When they say synthetic hormone, it's typically a chemical that doesn't even look like your natural hormone, but it prevents your natural hormone from binding. And even the FDA, it's like contraindicated over the age of 35, but we see women all day long who are given this for HRT. Like,
Yes,
this is a sad
my
thing.
client was just referred that, and I said to her, "Hold on, let me educate you a little bit," because I am her wellness coach. And people, it's hard because I don't blame the doctors. I don't even think the doctors know. I think like it's more the academic system is so broken, and I feel bad that they're probably doing something that they think is helpful, but they don't realize what they're even providing for their own patients. And it's probably an easier fix. Like, we're complicated, and it's a
I
little bit
think
more confusing to
it's
probably mix
it's
and
training.
match.
Like, I've talked to pharmacists about it, I've talked to doctors about it. We're trained to believe that if something binds to a receptor in the body, it doesn't matter what it does because it'll have the same signaling response in the cell. And so the birth control binds to that receptor. This is like really classical pharmaceutical thing. Like, this is the pharmaceutical companies also like trying to tell doctors this, that it's called progestin. We're able to patent it and make a bunch of money off of it. And then we tell everybody that it acts the same way as progesterone. And so doctors, I don't think they're doing anything. They don't think they're doing anything bad. They just don't know. Like, they don't even know what they don't know because they're just going off of their training. They haven't looked into it. They don't have the time to specialize and look into the literature like specialists have. So you're right. It's really, even doctors are very confused by it. So they tell women that, hey, I'll stop your period, or you need a progestin only kind of a thing for your uterus to protect it. And we're not
So
protecting
when you're
them.
doing
Yeah.
so progesterone, for those who don't know, that is uterine protective hormone, correct?
Yeah, it does more than that. It's like everything in your body, but we tend to like refer to that because it's so important for that bleeding, to regulate the bleeding is one of a huge function.
And so is there what can you explain the difference between what a bioidentical hormone is versus something that is a synthetic
Yeah, so the
hormone?
bioidentical is like one that we make that is identical, or as close as we can get it to the natural hormone that nature makes. So that when you take it, that binds to the receptor and you feel most like yourself. You actually get the best results because it's giving the same signal to the body as your natural hormone would. And it's the most natural thing you could do is simply just replace what your body's making or no longer making. So the difference between bioidentical is just that synthetic, and one is a chemical that doesn't look like your natural hormone, and then one that does look like your natural hormone.
Now, is there a time, like, how can somebody think about when to start supporting their hormone health? Like, is there any such thing as too early or too late when it comes to prevention?
I think it's never too. I really think women should be hormone replacement therapy should be a prevention. It should never be a treatment. So I know that's not realistic and I just want women to start if they can, even if they're 60 years old, they should get started, or 65. But the younger, the better. So the more you can prevent heart disease and bone deterioration in your skin, it's much harder to heal these things later. Women need to be thinking about it in their 20s. Like, even if you don't start until you're in your 30s, they need to be aware of it, that it's going to happen a lot earlier than they think. Because right now they're like, oh, it's like I'm 51. This is so far away. Like you said, like it's not even like on my radar right now. But a 25-year-old who has endometriosis, like definitely should be thinking that's why she has endometriosis. But even just somebody struggling with gut health and insensitivity, or, she's sensitive to everything she's eating. She's struggling with her mood. She's been offered antidepressants and ADHD medications, and she's having trouble with like anxiety. She should be thinking about hormones. And why would you wait until you're 51 to start something that's so beneficial for you your whole
I think
life?
that basically hormones needs a rebrand. I think most people associate like taking hormones with like being old or being kind of
Thousand
past
percent.
past due, instead of thinking about it from a preventative standpoint. I love that you said that, and more as like a support and a tool in the toolkit to keep you feeling like your best
It,
self.
it needs to be like, look, hormones are, like, you're right. It's kind of like something that we need to aspire to. Like, hey, I can't wait to start because I know when I get started, I'm going to feel great and I'm going to have like a good, appropriate formulations for me that were designed for me. Like right now, women aren't excited about it because I don't think the options are that great for them, like besides others, but they're thinking it. They are thinking about it though. They're thinking about like peptides, for example, and they're doing that, to feel better and get their skin looking good. Hormones are actually more effective and more powerful, and they could be thought of the same way as that. Put in the same categories. Like people are starting herbs and supplements, which are arguably not as safe. But you don't know what plants do in the body, but we will take a plant all day long sometimes. And they're not regulated. There's a lot of reasons why like hormones would be safer than even a lot of supplements that people will try.
I love that because I was actually my next question for you was going to be, I always think about things from like the midlife stack, like about stacking things. And I always say having a solid foundation, which is like your daily wellness habits, your wellness lifestyle. And then for me, that second layer is hormones before peptides. And I'm seeing now so many people our society, we love to pop pills. We're into quick fixes. And I know peptides is having a moment right now, but let's kind of talk about why the order of things really does make a difference, probably from a cellular level. Where do you find that hormones plays in sort of like the lifestyle shifts that happen during midlife?
Yeah. Such a great point because like I look at longevity and anti-aging as a pyramid. So really like your foundation or your largest part of your pyramid is hormone replacement therapy, and it needs to be done first. And I'll get into why. And then the next layer is like obviously diet and exercise is like important, but you can do all the dieting and exercise you want, but if you don't have your hormones in place, none of it's going to be effective. And then peptides, and then like supplements, and like maybe. So this is how you would like optimize yourself. And you can rearrange those within the pyramid, but the hormones have to be at the base. And you can use peptides like as optimizers. So I literally look at hormones like getting the bang for your buck, like 80% of your problems and anti-aging. And if you did nothing else but hormone replacement therapy, you are going to make a lot of gains. And then if you can afford it and you have the time and you like injecting or whatever, then you can add peptides here and there. And the reason why it's important is because one, peptides do not necessarily, like NAD and glutathione and GLP-1, they're still targeted. They still do like their functions in the body, but they don't do every function in the body. Like glutathione is not going to help you maintain your blood pressure and keep away the headaches and make your skin and hair look great. It's going to kind of whiten your skin a little bit, like brighten it. And then the glutathione will help you detox. Like it does great things, and peptides will do that. But hormones will literally like give you foundational health. They'll put your body in the environment that it needs in order to stay healthy and heal and have optimal health. And so that's why they need to be done first. But even if, let's say, you're coming to a longevity doctor like me and you want to be treated, I would still do hormone replacement therapy, even if you needed to lose weight. Like if your biggest thing was like, I gotta lose weight, it's fine.
You
But I
start
would
with the
still
hormones first.
start with the hormones first because it's like one,
Such a shift
when
because everyone is going to the GLPs first.
GLP ones, it's like, it's because, hormones, again, they've had they have a bad reputation. Estrogen has gotten the worst branding experience ever in the
Yeah.
history of but if you look at GLP-1, estrogen raises it. So the reason why you're probably low in this GLP-1 is because you've been low in hormones. So even the root cause of your metabolic dysfunction is hormone deficiency.
Yes.
And if you're young enough, you may not need a GLP-1 injection. You could just potentially like try to recover this pathway. And like if you're older, and it's okay if you still need a supplemental like synthetic GLP-1, like the Ozempic and Mounjaro and the semaglutide, that's out there. But I always recommend like, hey, let's see if we can get it with HRT. And if you start losing weight, great. If you don't, you can always add the peptide on. When you add like a GLP-1 injection peptide with estrogen, estradiol, you get a synergistic effect. You get a better response from the body, which means less peptide, which means that you can inject less and get the same results, which everybody wants when it's cheaper, but also because like, wouldn't you want to kind of do a little bit less if you didn't have to, right? So if you can get your body to do it on its own and not necessarily rely so much on that injection, or what if you took like a berberine instead of an injection and you got your result that you wanted with
Yeah.
HRT? So I
It
think, and
makes
then
sense. Like I think of things like kind of like coming over the hill and things are starting to like go down. As we naturally age, right? Things naturally go down. Our hormones are a big part of that. That to support that first at the base level before you add the boosters, like people are just like they're jumping too far ahead on the path rather than it's such a great point that you're bringing up that if you're supporting the hormones, which the loss can maybe be leading to that weight gain and that metabolic dysfunction, which people aren't connecting those dots, then you may not even need it in the first place. Or instead, they're doing the GLPs, they're overdosing. First of all, that's for sure. Everyone's overdosing unless you're obese and have diabetes. Like for the typical person that's taking them that it isn't in that category, they're being way overdosed or blowing out the receptors. And then they stop working over time. And the doctors keep saying just up the dose, up the dose, up the dose and they're going to run into a wall at some point. Like it's just a matter of time. And we're going to see that, I think, coming up in the next 2 years. That I want to also dive into. It's a perfect segue into the product that you created, which is Oestra. So, what made you create this product? And can you explain first what it is and what separates it apart from what's out there on the marketplace?
Yeah, definitely. So Oestra is like a all-in-one product. We talked about the formulations not getting into the body very well. Like progesterone is really challenging to get into the body, and it's our main hormone. Um, the beautiful thing about Oestra is it's like kind of an all-in-one product because women are doing like a patch, a pill, a low-dose vaginal cream. They're doing like a testosterone cream, and then they're trying an estriol face cream, and then they're still like trying to get the results that they're wanting. And it's because they're literally putting microdoses all over their body, and they're trying to get systemic results from that. And it's just it's inappropriate. Like it's not good care. If this is the standard of care, it's not very good. Like this is what
That
we need
is
to
the
address.
standard of care. Like
Yeah.
it seems like a lot of like patches being made on a woman.
It's like a terrible standard. If this is our standard, we need to like readdress it. Like I would challenge like anybody who's like, well, this is standard of care. Well, should we change it if it's no good? And so we have better, superior ways to get drugs into the body and hormones into the body, injection. But for women, like I think it would be miserable to have to inject every day. And we've known for 60 years, 60. Like anybody that challenges me that vaginal delivery is not systemic, I will show you 60 years worth of data that shows that you can put any drug vaginally and it will go into the bloodstream. We use it in the hospital in the trauma. Like we use it all the time to get drugs into the body. What if you can't swallow a pill? Well, we can
Oh,
get it other
wow.
ways, right? So we've known for a long time. We use vaginal delivery to get women pregnant. It's a common way we know it. The reason why low dose vaginal creams are not systemic is because they're low dose. They're designed for only vaginal dryness. It's
Yeah.
literally like 0.000005, whatever it is, micrograms. It's only meant to like kind of absorb there and help locally. If you get appropriate dosing, it goes right into the blood and you can raise levels up appropriately and you get stable blood levels and it's safe. You get consistent levels. And you also get less side effects because you're avoiding the liver and you're avoiding like these topical formulations and you're avoiding contamination. Like topical creams get all over the house. So the advantage of Oestra is that it's vaginal, and that's what makes it different. It's a vaginal delivery. It's like the only kind of its kind to deliver you basically, and then we talked about getting it into the body, but also all of the hormones in the right ratio. We need progesterone, estrogen, and testosterone. And Oestra will raise all of the three hormones, but it doesn't even have testosterone in it, which I think is important that women know that they have a pathway in the body that they can make their own testosterone from progesterone.
Yeah, we
And then
don't
it
know that.
doesn't, and it doesn't need to, well, so like just like men convert testosterone to estrogen. And we
Okay.
just and they need estrogen. It's good for them. We just let them make it. Women need testosterone, so let's just let them make it.
Now, was there
They've
a
been told.
need to supply, like, to have added support? Because testosterone with pellets and all this other stuff has been, like, a big trend, and then sometimes I even see doctors will start with the testosterone before they even test the levels of testosterone, based
I
upon symptoms, and then that has turned into a complete disaster I've seen with a lot of people. So, do
women
you ever have you had a situation where somebody's need to add testosterone on top of Oestra?
it's such a good point. It's like this testosterone, it's like it has been rebranded. So people are like, it's great for everybody, even women, and women need it. It needs to be 70 to 100. Like the labs are really high, almost to what we push men to sometimes. And it's like, so this women get side effects. They get acne. Of course, they get a libido, but they're also going to get acne with it, and they're going to get bloating and weight gain, get constipation. It'll wreck your immune system and digestive system. It'll disrupt your vaginal microbiome. It's not your primary hormone, and unless it's in the right ratio to estrogen and progesterone, it can cause problems, as you mentioned. With Oestra, we expect it, like actually very predictable lab levels with it. We know that testosterone gets around 10 to 30, right? So this is like normal. But some women like feel like they need to be at 70 or 100. If you've been told this or you feel like you need this, Oestra is not going to do that, but it'll get you in a nice normal range, which we need for libido and a lot of different functions in the body. But like sometimes mental clarity, but mostly just like libido. It's like the one thing that women do notice from it.
Yeah.
If you want to add on something separate, you can. What my experience is with our clients, we have them do like a tiny amount of DHEA or like a supplement like maca or ashwagandha, but sometimes it makes them super irritable or they get acne with it because the testosterone has now gotten too high. So oestrus for the vast majority of women, it's great. And even if you're a woman that has like autoimmunity, you don't want your testosterone really high. It'll make your autoimmunity worse. So adding on these separate things is not the best for you. You really need something like Oestra where you can keep that kind of in a nice normal range, but not too high. Testosterone, it's like more does not equal better for women.
I
And
think that's
then
important to hear because I think a lot of times we think more equals better. And also, with the different delivery systems, I only recently, well, a bunch of my clients, we all were kind of doing different research and comparing notes of like, okay, like I'm a firm believer, like, I rather, like, get ahead of something, like, I knew my hormones, I had done personally the Dutch test twice, and my progesterone, my estrogen was tanked. My testosterone actually was fine, my DHEA was high, and so I knew I needed some support and wasn't sure in which way, and I don't think a lot of people I know do the different creams, but can we talk about, especially, like, for families, how that sort of, like, ends up being around the house? I don't think people are really warned about that before they start that when they have families. Can you explain the difference of, like, why the vaginal is actually a safer delivery, beyond just us as a person, like, for
yeah,
everyone in the house?
when I started hormone replacement therapy, like as a way back 10 years ago, I started with topical creams. And, like a lot of my patients with like, they had 4-year-old children who would have breast tenderness and the dog's vulva would become swollen. And the vet would be like, okay, who in the house is using an estrogen
Oh,
cream? And
wow.
so it really, even if they're careful, they have to, the laundry, it can get on the clothes and get in the laundry and the towels and the sheets. And we've known this for men. Like we used to have them like slather androgel on their chests. And then the baby boys would spark like little pubic hairs when we didn't want them to do that, and they'd have to stop their testosterone cream. We absolutely know that topicals only like 30 to 40% of them absorb. Like that's it. The rest of it just stays on the surface of the skin, and it will get all over the house. We know it when we take lab testing. Some woman has put like estrogen cream all over her arm, and then we take a lab, we'll get a really high level because it's sitting on the surface of the skin. It doesn't absorb, and it's very erratic. And I wish women did understand that like vaginal you might get a little bit like on a liner, you could just wear a liner and throw that liner away. And that's where, if a little bit leaks out. And if, as long as you wait 4 hours before intimate contact with your partner, and even if they get, estrogen is not dangerous to men, but it's mostly the children and the pets, right, that you really want to worry about. But it's like men can get exposed to estrogen and they'll be fine the next day. So, but I just don't want it to get on the male partner because I want it on you. So that's why we wait the 4 hours, obviously. But women also need to understand that, like, when they put like a topical on their skin, they're going to get a different result. So for example, if they put testosterone cream on, it converts to DHT and makes their hair fall out. And so that's why when they start a testosterone cream and they get hair shedding, that's why. It's because the way they've put testosterone on their body. It's not necessarily the testosterone that's doing that.
Oh,
It's the
wow,
conversion
it's the
pathway.
conversion. Interesting. I don't
If
think anybody
they
would know that.
No, and if you inject testosterone, it tends to convert heavily to estrogen, which is good because then you get that estrogen effect. But you need to, those doctors aren't considering that. They're not telling women that. That's actually why they're going to raise estrogen and not testosterone. When you put a pellet in, you tend to get too much
Right.
testosterone, and that's where they get a lot of weight gain. And women think that they've been told that it's going to make them lose weight, but it doesn't. It makes people gain weight. Like, it makes men gain weight.
This is
Like,
the
that's what
confusion, Dr.
this
Sarah.
is
This
where
is
the
why we are so lost. I mean, I think most people, I mean, in the best way, you've really like helped to connect the dots. I guess there's no better thing than when you create something out of your own personal need, which is why you actually created this. And I actually found the delivery system, I didn't realize that there were so many, the efficacy. I always talk about things from bioavailability standpoint when you're ingesting a pill, but it's the same sort of thought process you have to have when it comes to hormones. Because a lot of people, we know about the gels and the creams. We know about taking a progesterone pill, but then there's also the patches. Is the same thing for the patch when the people are doing the estrogen patch? Is it also a 30%?
Yes, and that's why there are a lot of studies are coming out that women need variable doses or they need higher doses, and it's because everybody's finally recognizing the patches suck, that they don't work. Like, that you put them on and they don't, like, they're not absorbing
That's what
through
I
the
want
skin.
everyone to hear.
So it's like, I mean, finally, can we just say it? Like, why are we having these, like, again, we're prescribing HRT like it's 1990. Like, why
Yeah,
are we keep like
it's
stuck in
very
this?
outdated. And listen, the doctors, unless they're like willing and like an advocate and just like constantly looking and learning and trying to like advance, most are not doing that. And so they're just sticking to an old protocol. And what I loved about when I discovered Oestra, I told you, I was like, you are speaking to me. I was like, I know I want to support my hormones. I want to do it optimally. I'm not really sure like what that even means. And I want to do it where it's simple and easy and repeatable, right? Because you have to do it every day. And I think a lot of women initially when I've been like sharing, oh, it's a vaginal delivery, they kind of get grossed out. But I want women to get more, we need to get more connected to our genitals. I mean, men completely are connected to their genitals. And for some reason, as females, we are not. And it's not a big deal. Can you just discuss and explain the actual delivery system? It's a one pump. What are we doing every day when we're trying Oestra? What does that look like?
Yeah, you're right. It's kind of like a cringe. People are like, I think it's because
Yes.
we have to use like those monostat treatments or something, and we
Yes.
associate a cream in our vagina that way. I will tell you, the Oestra, you can't feel it. Like, it doesn't have a feel when you put the cream in. I get that there's a little bit of leakage, but that's a lot of women are need to be educated to. Let's talk about the vagina for a second. I think you're right on. Like, women are not educated about it. They're not connected to it. We need to associate libido with like lubrication too. Like, when you put men on testosterone, they get erections like all day long or whatever. I was like, it's be tough to be a man. But with women, when you start like a vaginal cream and it increases vaginal lubrication, this happens. And this is like the libido that women should be feeling. And this is also how like increase in blood flow that happens is also how the vagina cleans itself. So I get that the vaginal application can be a little bit messy, but a messy vagina is a healthy vagina. Like, women also need to associate the two. Like, if you have a lot of atrophy and dryness and you're not having that lubrication and kind of dischargey stuff sometimes, this is not healthy vagina. Like, we need to be able to clean this and keep this like a really healthy area and keep the pH right and balanced. And it's only a tiny amount of cream. Like, we're talking like a pea or pearl sized amount. You can put it like on the edge of your finger. It doesn't need to necessarily be inserted, which I think is kind of weirds women out sometimes. You can put it on the underside of the labia or the opening of the vagina. As long as it's vaginal tissue is where we're trying to get it absorbed, you might get a little bit better. results systemically if you insert it, right? Like up into that upper part of the vagina, but it does turn women off. So it's kind of but I would argue that I would rather put a vaginal cream on every day than inject every day, because otherwise we're do the injections. I don't think we could do like once a week injections like men do. That's what men do for testosterone.
Yeah.
Like if we did that, we would probably have breakthrough bleeding like the other 2 days, like every week, because you have this like huge peaks and valleys. Like you said, if you do something every day, it gets consistent results. And so this application allows you to just put a tiny amount of cream on every day and you control it. If you don't like how you feel, you have that it's
You could
gone
do
in
a
like
little bit
24
less.
hours.
I know, 'cause
Right.
when we spoke, I was like, "I'm terrified, I'm scared." Like, every woman is like, I've done progesterone creams before, and I feel like for some reason those made me feel very bloated, like a water balloon. So you're like, "Just do half a pump." And so that's what I did to start, and it definitely was, like, a really easy way to kind of, like, ease into the concept of, like, using hormones and not being scared of them. I think we're so conditioned to be scared of hormones, especially from being on I was on birth control for a long time, from, like, being a teenager, probably for at least 10 years before trying to become a mom. And it's always like low dose estrogen. Like we have that in our head. We don't want estrogen, low dose, where, we have to shift that mindset, especially in perimenopause. Like our estrogen is tanking, but that's leading to a host of issues. You want to boost your estrogen, not to make it too high, but you just want this like support. Are there, sort of like suppositories of hormones? Because I've heard about that before where people can insert like I don't know, is it a pill of estrogen? But sometimes those don't absorb. What are those?
They're super messy. We'll start with that. So, like, a lot of providers will, not a lot, but it's common practice, I would say, against like HRT doctors to have women just put in like the prometrium pill, the peanut one, the oil
Yeah.
one, vaginally. It's super messy, right? Like, you're basically putting in this like oily product in your vagina. How do you know what that does to your vaginal microbiome? It's not going to necessarily help the hormones absorb it that well through the membranes. And a lot of it leaks out. And this is like again, not like a superior way to try to take something vaginally. You can do cocoa butter suppositories that compounding pharmacies will make. They're like this big and they are super messy. Again, like, so you don't want, like, you just have this little tiny bit of cream with Oestra. Like, it's a better feeling product where you don't have as much discharge as these other suppositories. The estrogen suppositories or those pills are microdoses. They're really only meant for vaginal dryness. They're not systemic products. So this is the only thing like on the market that's really like combines and makes them like a one product plus it's a systemic. So there
So there
are
is
other
nothing
options,
else
but
on the market. I think that is like the most fascinating part. Like this is like the only thing on the market right now that is vaginal. It's a cream. It has is it estradiol that's in it and progesterone. And the biggest part is that you have this certain what is it, the balance of the hormones in a proper order for it to also be systemic so that your body, the term systemic, I think people don't know what that might mean, means that your body is absorbing the actual hormones as well. And it's
yep.
not having to go through the liver. I think people don't realize that our livers are clogged. Stress, taking pills, like everything has to be filtered. Think of it like a filtration system through your liver. And when that gets backed up, that's leading to other issues. So I think anything we can do to not have our liver involved is a huge bonus for us. And what is the system? How does somebody, because I think it's a different concept. I think it's an amazing concept that it's online. People, you don't need a doctor appointment per se. You're really putting the power into people's hands. How can someone it's a total mind shift because most people want to go to the doctor. They want to be told what to do instead of online seems like an unusual concept. So how would you
Yeah, women
discuss
do
that?
need to take the power back, that they like get to, kind of choose how much cream they put on every day, just like you did. Like, okay, you really have all the power here. And doctors do too much gatekeeping to begin with. This should not be gatekept. And it's true. It's online. We're in 46 states, and you can get started. We put you on a starting dose. So depending upon really your age is like the starting dose that you would get started on. And then we can increase that dose. Like, so you can always raise it, right? But women are like, how do you know that that's the right dose for me? And I'm like, I don't, but you have to start somewhere. And it's kind of like where you were like, I want to get kind of eased into it. So you can start with a little bit less and then kind of gradually go up. And this allows you to do that. And then you can meet with a provider at any time. So you can always get started and then schedule with a doctor, one of our providers, to ask questions or make sure if you have side effects that need to be addressed, like what's going on. If you have bloating before you started and it gets worse, this is something that we need to address because it's your gut health that's at stake here, because really this is the HRT is not going to treat your SIBO, but it's going to make it worse, but it will eventually kind of make it better. But you have to, like, there's a time period where you have to address it with maybe a supplement. So we're here to help with those symptoms. And so you kind of get hopefully the best of both worlds. If you want to get started and not have to meet with somebody or talk to anybody, because a lot of women are tired of being told no, they're tired of being told that they
Yes,
don't need
it's
it.
really a fight. I mean, I have a client of mine who is not in menopause yet, but getting close. I just turned 45. She's 50, and she's still not prescribed hormones, and they're doing the Ozempic and so forth first, and it drives me crazy. I'm like, why not? It's like we have to like keep fighting to get it or beg to get it. Even for me, I could just speak from my own story. Definitely brain fog, mental clarity was starting to like really become glaring as like an issue for me. And even with the Dutch test, the double low hormones, we reviewed it, still did not offer me anything and just said, welcome to perimenopause. Like not even
Yikes.
supplements. And I just was like, that's really what drove me to then I like found your product and I was like, all right, I am just taking matters into my own hands and I'm going to support it. And I do love how you have essentially like 24/7 support. I mean, you are more in communication with you guys than you are your own doctor because you can text at any time and discuss kind of what's going on. And I think that that is transformative in the women's health space for sure. Um,
I love it. Thanks for the feedback. And we're going to have an app. So hopefully this experience will get even better, that you really feel like we are there to ask questions anytime. So
Because we know we have a million. I feel like I had a million. That's what I was like telling my clients. I was like, and you're not even embarrassed or ashamed. And I think it takes away that shame of being annoying or asking too much, that you can just like ask all the time and you're getting responses in real time. I feel like we've heard all like the good things that hormones do. Are there any like negative things that we can discuss, side effects, complaints that you've heard from people who start hormones?
I think side effects are going to be, they're not side effects as so much as they are because they go away. Like if you have breast tenderness, like you need to treat that underlying breast tenderness, which is fibrocystic breast disease. So it can highlight, when you start hormone replacement therapy, it can highlight, some people will be like, well, it causes more problems, but it doesn't. It highlights things that you need to address that you've literally been waiting a decade. Like you wait 12 years before you started HRT, and now you have a lot of gut issues or your
Yeah.
thyroid's like, yeah. So these we do need, you're right. Like there can be water retention, there can be cramping from the uterus, there can be a little bit additional bleeding. I would say water retention and bloating are probably like not fun symptoms that women get at first, but I think they need to remember that men have a lot of side effects like water retention and bloating too when they start testosterone. You need to adjust for the 3-month period. You also need to sometimes address these with supplements. Like you need to heal your gut. Maybe you need to work with somebody else. Like we'll try to do what we can. And then maybe even working with an additional provider on these other wellness things that in order to optimize, it's a, like you said, this is just the foundation. And then working with other
Right. Then you
providers
can
to get all
layer
the other
on top.
pieces.
And how
Exactly.
long, because we're such a instant gratification society, should somebody who is going to start this journey, should they be patient with their body to allow it to adjust? Like what is the timeline for that?
We tell women that, look, the first 3 months is about healing. We need to make sure that you don't have a lot of bleeding and that you don't have a lot of breast tenderness or that this goes away. And so really women have gone here, they go years without estrogen and progesterone particularly, and they have, their uterus is not in the best shape. So we want to make sure that this heals. So the first 3 months are about your skin and hair, your sleep. Like, can we make sure that everything's healing and starting to turn over and you kind of see those results visibly? Is your mood getting better? Is it becoming more stable? We don't worry so much about weight loss and libido at first because you have to have health to lose weight. Like weight loss is not the measurement of success.
Yeah.
Health is the measurement of success. And if you're healthy, then you'll tend to lose weight. If you're healthy, then you'll tend to have a libido. Like really, these things need to be looked at. They're markers, but they kind of come later. And then after the first 3 months, you really by 3 months should be feeling a lot better. But then after that, 3 to 6 months is more about optimizing. Okay, should we raise the dose? Should we get your skin and hair looking even better? What about libido? Okay, what about weight loss now? Can we start addressing weight loss? I don't expect any woman to lose weight in the first 3 months. And she needs to understand that that's like
I
not
think
going to
that's
happen
good
early
to
on.
hear.
And so it's like, look, we actually just, some of them even gain just a teeny bit, but then it stabilizes and then you can start to lose it because you're reshifting these like metabolic dysfunction that's happened in the body. And so I would say 6 months, like, look, it's a 6-month journey of healing. By the end of 6 months, you shouldn't have any, your periods should be really light and short. You should love your skin and hair. You should start to really feel that libido, vaginal health should, even all this atrophy should be cleared up by then. You should have that 20-year-old vagina that we're hopefully all
Wow.
hoping for.
Okay. So we
Because
don't need those. What do people do? Those laser treatments?
those are all like, estrogen will do the same thing. So, I was hearing on social that the vulva like shrinks and disappears. And I was like, yeah, this shouldn't happen with you're on hormone replacement therapy, like a good systemic or whole body treatment. It will help remodel the vagina. You should have that. It should look like it did when you're younger, and you should have the same feel. Sex should be better over the age of 40.
Wow.
And so, but this is like a journey. And you're
It's
right.
a
It's
journey, and I
not
like that you're
instant.
coming at it from a health standpoint. I think that's such positive messaging for women. I think we beat ourselves up too much, and we're so good at taking care of others, but we're the worst at taking care of ourselves, and this is like a real opportunity where we really need to give ourselves a hug and give ourselves the time to allow our bodies to ease in. And I guess that's to your point that the earlier you do it, the better, because then you have less of a mountain to climb of things to sort of resolve based upon all those the effects of the lower hormones and what it does to our body.
You nailed it. Like if the earlier you start, the younger you are when you start, the less those side effects that you have, like the less of the mountain to
I wish
climb for
I knew
sure.
that. I mean, my hair fell out a year and a half ago. I thought it was from stress, and then I realized, oh, it probably was stress triggered, but also hormone related. And I will say my hair fallout has been much less since starting. I'm only entering my 3rd month, so I'm still in the entry phase, but my mental clarity and recall is fully coming back so much faster. Like it's unbelievable. Before, I would have a conversation, forget what I was saying, but like, all right, it'll come back to me and I'd have to just give it time to come back. And now I can give it like 2 seconds and it comes right back instead of a few
That's
minutes.
It's amazing. And we should have that cognitive ability. Like as we're aging, we should not lose that. It's devastating when we do. And I love that you're having like good that you're seeing it, and we'll probably should go up, right? Like this is kind of where you're through this initial everything's going well. Like I want to, and then we can kind of raise it and then see how you do and see if your hair, if you love it even more in your skin. And like you get the even more mental clarity because of your age, you should. And so this is like kind of the journey. And then I tell women, look, even a year or two after you start Oestra, you should feel even better every year. Like when the next day gets even better than the day before, like
Wow.
I probably look better and feel better than I did in my
I
20s.
mean, you
One, I'm
look
taking,
amazing. If we can all look
thank you.
like you, Dr. Sarah, I think that you're the best testimonial for your own product. I
Like
mean,
it's like the men's hair loss club. He's like, not only am I
yes.
the founder, but I'm a user.
Yeah,
So,
I think it's great. And really, I think making it so accessible, I think that's what excites me the most is that you don't have to wait months for that next doctor appointment. You can get started immediately and you have support of practitioners to answer all your questions and even have a consult as well if you need to have a deeper dive. And it really is a very supportive experience beyond an appointment that I've had. So I wanted to say
thank you.
thank you for
Thank you.
that.
Oh,
It's
thank
really
you for that
great.
feedback.
So to close out this amazing chat, what is one drop of wellness wisdom you'd like to leave with our listeners today?
Somebody asked me the other day what the best medicine is, and I still like I would be like HRT, right? But I think really like nature. Like I don't know. I went to the hiking the other day, and I think we need to keep remembering that that's one of the best like wellness tricks is just to get outside, probably get in the sun. Um,
Great. Yes, I couldn't agree more. I just came back from the mountains and the fresh air. I was like, I wish we had a test to see there has to be more oxygen where we are right now because of all the trees. Yeah, just
totally.
getting into nature, grounding, fresh air. It's
Yep.
important. I think we get so stuck in sort of the Groundhog's Day of everything of going from the house to the car, whatever it is. We're indoors way too much. We have to actually force ourselves probably for some more outdoor time.
I agree.
Well, thank you so much for being on the Well Drop. And where can we find you, Dr. Sarah? Where can we find Oestra?
On www.innerbalance.com.
Great. And we will put it in the show notes. And yes, definitely
And I
highly
can
recommend giving it a try.
I'll provide a coupon as well for everybody
Perfect.
listening.
We'll put it there. Thank you so much for being on the Well Drop with us today.
Thank you.